Here's a shocking revelation. Nearly 60% of Americans disapprove of Robert F. Kennedy Jr.'s actions as health secretary, according to a recent poll. But here's where it gets controversial. While Democrats and independents overwhelmingly reject his leadership, Republicans trust him almost as much as their own doctors. How did we get to this point? Let's dive in. A new survey sheds light on the growing divide in how Americans perceive health information. And it's not just about medicine. It's deeply tied to politics. Take, for instance, former President Trump's controversial warning last September about acetaminophen, the active ingredient in Tylenol. When Trump advised pregnant women to avoid it, the public's reaction was starkly split along party lines. And this is the part most people miss. 59% of Democrats dismissed his claims as definitely false, while 56% of Republicans believe them to be definitely true or probably true. The science? It's clear. There's no evidence linking acetaminophen to autism. Yet, the partisan gap persists. This isn't an isolated incident. The poll reveals a broader trend. Trust in federal health agencies like the CDC has plummeted, especially among Democrats, as the Trump administration sought to overhaul its policies. For example, trust in the CDC's vaccine information among Democrats has dropped by 24% in just 2 years. Meanwhile, Republicans are increasingly turning to figures like RFK Jr. for health guidance, despite his overall low approval rating of 59%, driven by Democrats and independents. So, what's happening? Ashley Kurtzinger, Associate Director of Polling at KFF, explains that while people historically trusted their doctors most, political affiliations now heavily influence where they seek health advice. Here's the bold truth. Among Republicans, RFK Jr. is seen as a credible source, rivaling their own healthcare providers. But Democrats are turning elsewhere, relying on professional medical groups like the American Medical Association, AMA, with over 80% expressing trust, compared to just half of Republicans. This fragmentation in public health trust raises a critical question. Are we entering an era where health decisions are dictated more by political loyalty than scientific evidence? As Kurtzinger puts it, partisanship is playing a big role in what people decide to do. But what does this mean for the future of public health? Is this divide sustainable, or are we headed for a crisis? Share your thoughts in the comments. Let's spark a conversation that matters.